I'm Robert McKenna. I'm a thoracic surgeon at the John Wayne Cancer Institute at St. John's in Santa Monica. I was trained at USC, Stanford, and MD Anderson, the top cancer hospital in the United States. My focus is general thoracic surgery, which includes everything in the chest. In particular, a large part of my practice is focused on the treatment of lung cancer. So I developed how to do a minimally invasive lung cancer operation. And I've trained thousands of surgeons over the years, either visiting my hospital to watch or to travel around the world to many different countries to teach them how to do these operations. I've been using DetermaRx for about 1 year. I felt that it really filled a need for me in my discussions with patients. I do cancer surgery, and I wish that every cancer operation I did cured patients and that it never came back. Unfortunately, sometimes the cancer recurs. It would be nice to identify which people have their cancer recur to then try to treat them with something to prevent the cancer from coming back. Conversely, it's nice to know which patients are going to be cured by my operation so they don't need to go through chemotherapy because they've already been cured. I think that DetermaRx is practice-changing and very important for discussions that we have with patients. I like giving patients enough information about their situation and the pros and cons of additional treatment after an operation, so they're loaded with the information to decide and make a good decision. Do they or do they not want that adjuvant treatment? Clinical validation is critically important in the decision as a physician to offer treatment or to not offer a treatment. The NCCN guidelines currently, for example, for stage 2 lung cancer, recommend an operation plus or minus chemotherapy afterwards. Plus or minus is not specific. You need data to really identify who should get that treatment and who should not. The study that convinced me the most to start investigating this and start using DetermaRx was just the initial work that showed the validation that they could identify patients with high risk, intermediate risk, and low risk. I talked to my patients about why they needed an operation ahead of time, and I performed the operation. My job is not done when I put down my scalpel at the end of an operation. I think that DetermaRx is impactful in a clinical setting with surgeons and medical oncologists. I think it's important because we don't live in totally different worlds. Patients are treated by both specialties, and it helps to tie it together and make patients feel more comfortable. They feel that they've got a whole team taking care of them and doing the best they can to cure them.